On this week's episode of Anecdotal Evidence, Dr. Marcia Brand, Senior Advisor at the DentaQuest Partnership for Oral Health Advancement, and Mr. Alan Morgan, CEO of the National Rural Health Association, paint a portrait of rural health in America. Americans living in rural areas often face significant health inequities, driven by barriers to accessing care, including reduced health workforce, geographic distance to care centers, lack of infrastructure, and cultural factors inhibiting treatment. Marcia and Alan discuss how public health advocates can bridge these barriers to reduce health inequity. Here's a preview of our conversation.
When we look at our data, close to a third of the nation's rural hospitals could possibly close in the next 10 years. That would dramatically change rural America. But it gives us such an opportunity. And that's, I hope, and this goes for oral health as well, too. There are just such tremendous pressures. The current model is non-sustainable. And so you really see some amazing innovation happening out there for primary care, for hospital care, for oral care, of how we redesign the healthcare system. That's the cool stuff that I think people don't realize, that where we're going to have our health system 20 years from now is really where rural is today.
You know, if we lose these small emergency departments, then I don't know where they're going to get their care. There was a study done not so long ago that suggested that up to $2 billion worth of uncompensated care is delivered in emergency departments for oral health, and it's the wrong place. You know, that you're not going to be able to treat the underlying problem. So one of the things that I'm hopeful going forward is that we will look at strategies to, certainly as Alan's saying, preserve these small rural hospitals, but also create relationships between these small rural hospitals and other providers in the community, so that this individual leaves the emergency department with something to treat the infection, something to help them manage the pain overnight, and that sometime within the next 24 hours, that individual has the underlying problem addressed, you know, whether they need to be have an extraction. But we lose so much money in emergency departments, and it contributes to the problem that Alan's talking about.